Representative Paul Ryan, Chairman of the House Budget Committee, thank you very much for talking with us.
It's great to be with you, Judy. Thanks for having me.
You say your plan would cut more than $6 trillion from the Obama spending plan over the next 10 years. So the question I have is, what is it that Americans won't get under the Paul Ryan plan that they would have gotten under the Obama plan? What do you eliminate?
Wow, where do I begin? We go after lots of waste and duplication. We take lots of the recommendations from the President's Fiscal Commission, which he disavowed, which we embrace. The General Accountability Office told us about hundreds of different programs that are duplicative. We propose reforms in many, many areas. We propose to reduce the federal workforce by 10% over 3 years through attrition. We propose to reform farm programs. We propose to get rid of corporate welfare, the bailout fund in Dodd-Frank, a lot of the corporate welfare in the energy sector. We propose to move Fannie Mae and Freddie Mac off the taxpayers' books. We also propose to cut discretionary spending. We get $78 billion out of the Pentagon. We also propose structural entitlement reforms that are necessary to bringing solvency to our entitlement programs so that they're safe and secure for future generations. So the President gave us a plan that spends so much more money. He doubles the debt by the end of his first term, and he proposes to triple the debt by the end of his budget. And what we're offering is a different direction. In our plan, our budget literally pays off the debt.
One of the main things you do, as you just suggested, has to do with Medicare. You essentially end Medicare as we know it, and you replace it with a system of subsidies to private insurers. Why is that better for seniors?
Yeah, I wouldn't say it ends Medicare as we know it. Private insurers are already in Medicare. Medicare Advantage is nothing different than what I'm talking about, which is about 20% of Medicare beneficiaries get comprehensive private plans.
That's one part of it.
Medigap is private plans. The Part D benefit is private plans. So what we're doing is we're taking a look at the lessons that have worked. The prescription drug benefit, for example, that came in 40% below cost projections. We're copying that kind of a model. So specifically what we're saying is if you're 55 and above, no changes whatsoever in Medicare. But if you're like me, if you're 54 and below, Medicare is going insolvent by the end of the decade. It's going bankrupt, and it's leading our country toward bankruptcy. So future seniors, 54 and below, will get a list of Medicare-approved plans, kind of like how it works today, but for all of Medicare. And it's a system that works identical to the one members of Congress and federal employees have. They choose among the Medicare plans for their business, and that choice and competition actually helps bring down costs and expand availability. And the actuaries at Medicare tell us that doing it this way brings Medicare into solvency and pays off the debt.
So instead of making payments directly to hospitals and doctors, the payments would go to private insurance plans, in effect moving toward privatization of Medicare.
No, I wouldn't say that. If that's the definition of privatization, then Medicare is already privatized. Because already Medicare works through private companies to deliver services to Medicare beneficiaries. So if you're calling that privatization, then it's already privatized. If you're suggesting that the federal employee health benefit system is a privatized system, we're just basically copying the federal employee system. The key is this.
That's a plan that doesn't have a cap on payments.
Sure it does, yeah. No, the federal employee benefit system only pays so much, and then the federal employee pays the rest. They pay about 75% of our costs, and then federal employees pay about 25% of their costs. It works like that. See, the key is this, Judy. We want to have choice and competition, and having these insurers compete against each other for the Medicare beneficiaries' business, that gets savings. That roots out the billions of waste that we have in Medicare. The current Medicare structure is a structure that's going bankrupt. It's a source of health inflation. It involves billions of dollars of waste in Medicare, and we can go after that kind of waste, and we can stretch our healthcare dollar farther by doing these kinds of Medicare reforms, which basically says that younger people, Medicare will work like the plan that I have as a congressman and other federal employees have. That's not a privatized system.
Let me ask you about Medicaid. You would turn over to the states more of the control and the costs for health care for people who are poor, who have disabilities. It would be a lump sum system, but the total amount of money would be less. So why is that better?
Yeah, so here's the problem with Medicaid. It is a one-size-fits-all federally run program that is administered by the states. We have dozens of letters from governors saying, give me the freedom to customize Medicaid to meet my state's particular needs and problems. We're telling the states how they run this program, and the program's not being run very well. It, too, is going bankrupt. It's putting pressure on state budgets. It's growing at an unsustainable rate. So what we're doing is we're growing Medicaid at a slower pace. Medicare and Medicaid grow every single year under this budget. There's more money next year than the previous year. The key is this. We're giving the states the ability to free up reforms so they can customize their Medicaid to fit their population.
But is the ultimate goal fewer people on Medicaid?
Well, hopefully we have more jobs and more prosperity so people aren't on Medicaid. Of course, we want less people on Medicaid because that means people are making more money, they're having better lives, and they're having more income. This budget also has been scored by outside economists as increasing disposable income, increasing jobs, lowering unemployment, bringing more prosperity to America. The key is to fix our social safety net. What we're trying to do here is couple Medicaid reforms with food stamp reforms, housing assistance reforms, education reforms for job training. We're trying to couple these things by sending them back to the states in block grants so the states can combine these dollars to reform the tattered social safety net. The problem we have, Judy, is the social safety net is tearing apart by the seams, and we need to modernize the safety net for the 21st century because these programs haven't really been reformed since the 1960s.
Even some people who like what you're doing with regard to cuts, like Alice Rivlin, like some Republican senators who have said, who compliment what you're doing, their view is that you can't just go after entitlements, you also need to deal with revenues. And they're saying you're not doing that in the essential way that one needs to.
Sure. So I think that's probably an accurate description. I don't think raising taxes is a good idea in this economy. We need to have economic growth and job creation. Raising taxes on businesses at a time when they're struggling to compete in the international economy doesn't work. The other problem I'd say is this. We don't have a problem with these deficits and debt because people don't pay enough taxes. The problem with our deficit and debt is because Washington spends far too much money. We're spending all this money we don't have, and it's that spending that is the core root cause of our problem. And so we want to address the root cause of our problem, spending, and then we want to reform the tax code so that it raises the same amount of revenue it does today, but does it in a far more efficient way to get economic growth and job creation growing.
And very quickly, to the criticism from Democrats who say, yes, you're addressing the deficit, but you're doing it by letting the wealthiest Americans keep their tax cuts, but you're balancing the budget on the backs of the poor and the most vulnerable.
We're getting rid of corporate welfare. We're means testing programs so we don't subsidize wealthy people as much. And we are reforming the tax code to get growth. You got to have spending cuts, spending reforms, and economic growth and job creation. That's the